Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Characteristics of menstrual cycle. In menstrual cycle, initially there is high levels of progesterone support is present. Eventually, the progesterone level decreases and the support of endometrium is lost, resulting in menstruation. The most important hormone needed for menstruation is progesterone. Progesterone cannot act on endometrium unless the endometrium is already primed or activated with the estrogen. In case of postponing or preponing the menses 2 to 3 days before the expected date of menstruation, you should start progesterone, that is 5 milligrams of Primulate TDS is started. This 5 milligrams of Primulate is high dose of progesterone levels. Once this progesterone levels or this tablet is stopped, the level of the progesterone will go down and the menstruation starts in 2 to 3 days.
thank you and thank you for watching.